Welcome to the Wayside Maternal Infant Health Education Series. I'd like to begin with the bio for Dr. LaVonne Moore. Dr. LaVonne Moore has a Doctor of Nursing practice from St. Catherine University, a Master of Science in Nurse Midwifery from the University of Minnesota, and a Master's of Arts in Health and Human Service Administration from St. Mary's University. She is a certified nurse midwife, certified women's healthcare nurse practitioner, and international board certified lactation consultant and certified childbirth educator. She is an adjunct faculty at several universities, including Thomas Edison State University, teaching graduate nursing and women's health courses. She practices at North Point Health and Wellness Center and is the founder and CEO of Chosen Vessels Midwifery Services and the Chocolate Milk Club, a culturally specific service of Chosen Vessels Midwifery Services that provides breastfeeding, education, and support for African American women. Her goal is to use the midwife model of care to inspire all women to breastfeed and support all those that do, because she believes that good health begins with breastfeeding. Without further ado, I would like to introduce you to Dr. LaVonne Moore. Thank you.
Thank you, and good afternoon, everyone. Thank you so much for joining us. I hope you can see me, as it's always a challenge in this new era with the pandemic of doing everything online and getting used to all of the technology. So I hope everyone can hear me okay. Is that right? Can you hear me okay? Thanks, Nicole. So I appreciate you taking the time to come to this presentation this afternoon. I know we're all so busy and stressed during this time. And I just want to give you a little background for the context of my presentation this afternoon. It's entitled Got Chocolate Milk and the Role of Culture in Breastfeeding. And this next, Nicole, this stems from, Nicole, can you see me okay? So what I'm just going to do is this to signal you, okay? When you need to move that slide. So thank you very much for helping me in this way. So just to give you a little context, as Nicole introduced me, I have a doctorate in nursing, and my doctorate work was done on breastfeeding in the African American community. In looking at solutions to address health disparities, I was concerned about what it was that we could use, what were the tools that we already possess that we could assist our community in improving its health disparities. And so breastfeeding was the tool that I looked at because of its vast array of benefits, which we'll share later about in terms of looking at health disparities. And so I did my doctorate research looking at African-American women in the Twin Cities area around this. And so from that community-based action research that I did, I developed the Chocolate Milk Club. And the Chocolate Milk Club is in response to what women in our community said that they wanted and needed in order to support them in breastfeeding. There was this assumption that we'll talk about later as well in the medical community that Black women did not want to breastfeed, but what we found is that yes, they did. And there were some important cultural pieces that are connected to that. And so that's what we're going to share today as we move forward to talk a little bit about this important topic of the role of culture in breastfeeding. So that picture just reflects one of our events at the Chocolate Milk Club, our annual Chocolate Milk Day, and that is one of our peer support people who will assess women with breastfeeding. But the importance of breast milk is so key. And we know that it's a specialized human infant support system that's multifaceted and complex, and it provides protection, information, and nutrition to the nursing infant. It's an intense and profoundly human experience that positively influences women's perceptions of themselves as women and mothers. but there's a complicated history behind it for when you look at Black women. So just know African-American women, Black women, I'll be using those terms interchangeably today. But there's a complicated history behind that breastfeeding and what goes into the decision making. And so we want to explore the narrative around that, because it's important to not just look at the data, but what is the story behind the data? And so that's really what we're going to be talking about today. We know that quantitative research is important, but so is qualitative. And here in the narrative piece that really shows the story of the numbers. We know that the benefits of breastfeeding make it a practice that is important to be revived and restored and reclaimed. And so that is one of the reasons why breastfeeding is so important to our community and to this population. So let's talk a little bit about culture, okay? So culture, breastfeeding is both a biological and socially constructed phenomenon. And in recognizing this ontological perspective, culture and historical perspectives are required. You can't look at breastfeeding and look at numbers and the data around African-American women without taking into account the historical perspective, because it doesn't give the data justice, right? That story is so important. And so when we, unfortunately though, the majority of studies that have been used or done combine race samples when they examine issues associated with African-American women and breastfeeding. And that makes it difficult to isolate really what are the influences around it, and especially those cultural influences. So comparing, you can move that, Nicole. So comparing Black women amongst themselves across social class backgrounds yields a much better understanding of how culture may contribute to breastfeeding disparities. And some people say, well, why is culture important? Well, one of the reasons is because we are the longest acculturated ethnic group in America. And with that comes some perceptions that are incorrect. And one of those include the fact that we do not have our own culture. Another one is that we're homogenous people. And another one is that anyone can provide care for us because we're assimilated and we're like everyone else. And we know that that's not true. Nicole? So ethnicity in the research that I did was found to be more important than any other factor determining breastfeeding rates, right? Again, culture does make a difference. Ethnicity means more than just biological definition, but it's inclusive of shared social and cultural heritage that's passed down through successive generations. So there's a shared cultural experience of Black women that impacts their breastfeeding. This is one of our breastfeeding Chocolate Milk Club members breastfeeding at one of our gatherings. And as you can see, she's enjoying this experience. We find that women really, once they have been educated and they have the support that they need to breastfeed, that there's a lot of joy in this type of connection with one's babies. So there's that historical legacy, right, that impacts all of this. So I want to talk a little bit about the history that impacts all of this. Again, the narrative that really helps to give a better understanding to the data. African-American women face a particular legacy of embodied exploitation in which their sexuality and reproduction were not within their control, right? We all know that part of our American experience is an enslaved experience. And with that comes a lot of trauma and a lot of issues for African-American women around their sexuality because they are exploited. Their bodies have been exploited during this process, right? We know that both slavery and the eugenics movement in the United States has linked the animality of breastfeeding to Black females and the purity of womanhood to white women. So this perception, again, of who we are and what our bodies are is very important to how we connect to our pregnancies and to how we feed our babies. Go ahead, Nicole. Black women have suffered a heavy emotional and physical plus psychological effects of giving birth, under siege to their slave masters, and breastfeeding their masters' children, sometimes at the expense of breastfeeding their own children. There are various slave narratives that talk about women who have fed their master's children, and by the time they fed their children, they may not have milk for their own babies. You can turn it, Nicole. The other thing is, some plantation owners favored the use of their slaves for wet nursing because they believed that African mothers could transmit immunity to malaria to white babies through their breast milk, which was not true. It was Black mothers could pass immunity to their own children through the placenta, but not through breast milk. So this perceived notion also contributed to the exploitation of Black women. And if there were no women on a plantation to serve as a wet nurse when needed, then slave owners with new babies sometimes hired out those new mothers or purchased new mothers from other plantations, and forcing enslaved mothers to leave their infants behind and feed other babies. There's slave narrative stories where babies are in the field with their mothers, and in doing that, babies may die from exposure to the elements of sun. They may have also died due to dehydration and or to rodents such as snake and other animals, as a woman is working on one end of a field and her baby that has been settled into a little, they would dig out little holes in the ground, in the soil, to kind of sit their babies and support them in while they continue to pick cotton. And they may come back and those babies are no longer living. So Black women, through this process of being enslaved and the definitions that have been assigned to them, have been represented the most essentialized other of all groups to white Americans. And Black women's sexual and reproductive bodies have been cast as licentious, dangerous, and impossible to rehabilitate over the years. We know that as a part of the propaganda of slavery, there were lots of negative messages that were told about who we were as women and our sexuality in order to support maintaining that slave system. You can turn it and go. This is another beautiful picture of one of my Chocolate Milk Club members breastfeeding. And I think it's important when you talk about or think about the history that these women are overcoming, right, in order to feed their babies, and to understand that really our breast and the purpose of that breast and the importance of nourishing our babies through our breasts. Because when we look at the exploitation and demonization of their character and bodies as women and mothers. I'm sorry, you're going backwards, my dear. That's okay. That's all right. There you go. The exploitation and demonization of their character. Go back, Nicole. Sorry, honey. You're moving too fast. There you go. Okay. And you can still see me, right, with my thumbs up. Okay. So the exploitation and demonization of their character and bodies as women and mothers, and their lack of privacy may have contributed to their desire to escape all of this control, this external control on their bodies, and the judgments that are placed on their bodies, leading to them to reject breastfeeding, which for them may appear to be a more animal-like aspect, right? Or an animal-like activity. And so when you see the women, when I have these pictures of these women who are smiling and enjoying feeding these babies, this is really a big deal when you think about the historical legacy that they are breastfeeding through. This is the barriers, the potential barriers that do complicate women's choice around breastfeeding. Go ahead, Nicole. Thank you. There is no doubt, okay, there's no doubt that African-American women's experiences are reflected through the distinct historical lens of slavery and racial hatred. And you can understand why. Those are just a few of the examples of historical information that women are breastfeeding or fighting to breastfeed through, is what I call it. Because we know that the negative meanings that have been cast on our bodies, that definitely impacts not just our breastfeeding, but also how we perceive our bodies sexually, as well as pregnant women and pregnant beings. So we know that history impacts that. You don't get over hundreds of years of being enslaved and that goes just away because you're given your freedom. You have to also understand that this system did not necessarily just end with slavery, right? Those of us who know our history know that we still had Jim Crow, we had race for a period of time, we had racial segregation. All of those are part of this enslaved system. It's a continuation that kept people oppressed, that kept people in their place. And it certainly impacts how we obtain care, how we perceive care. And so that is why, you can go ahead, Nicole. Why you're going backwards again, sorry. So that is certainly why, given all the external monitoring of their bodies during pregnancy, that African-American women may simply desire to have their bodies back to themselves, okay? That is also why they may perceive a breastfeeding in a way that you may think or not understand why, but it comes from historical perspective, because all of that trauma does not just go away in a short period of time. And we understand now, as people becoming more conscious about trauma and understanding that and the importance of that healing takes time. And part of that healing is recognizing and having a conversation about our history and helping us to move forward from that. So why is this important? Can you go forward, Nicole? Again. Thank you. This is important because Black mothers have been marginalized, okay, and have experienced less health system support for breastfeeding, fewer role models, lack of access to cultural care, and have reduced exposure to evidence-based interventions that promote and enable breastfeeding. I found through the research that I did that this is what women told me. They did not, people perceived they didn't want to breastfeed. They just would come in the room and ask, are you going to breastfeed? They wouldn't educate them about it. And they just say no because they don't know about it. And then they just would walk out of the room. They did not have large numbers within their family or community breastfeeding, so they didn't have the role models available. There was lack of access to cultural care providers who look like them. The majority of women that we see in our community, everyone that they interact with is a person that does not look like them. And if they had received any public assistance, everyone that they interact with is normally do not look like them, right? The social worker, the nurse, the doctor that they receive care from. So this does make an impact in this reduced exposure to evidence-based intervention. We did not have a lot of cultural care models that were there. We were talking about the importance of different types of care. We've been talking about the importance of doula care as it relates to maternal health, and that's really an important piece, right? It's that support piece that comes from midwifery, but we were not looking at the importance of breastfeeding and how that can impact and address maternal child health issues. But it does, and women do want to breastfeed and are willing to breastfeed with the information, with additional information and support. So this historical context must be appreciated to effectively understand the interface between the individual's ethnic and racial experiences and their health beliefs. Because comprehending cultural beliefs is important to understanding feeding practices and the decision-making process that's involved in that. And we see this come out with COVID, right? With COVID-19, that it's important to understand people's cultural beliefs and practices and the decision-making process that's involved in that. When we look at African Americans and their fears and concerns about getting a COVID vaccination, and that has allowed all of the misinformation to come in and pervade and prevent people from getting this vaccination in the numbers that it should. And that stems from the cultural beliefs that stem from their historical experience in this country, right? And that continues to play out in their decision-making process, and that includes in their health decision-making process. So we see this in COVID as well. Breastfeeding is a cultural practice, okay, that takes place within the context of family and community. And this is important for African Americans because what we do takes place in the context of our families in our communities. And what those family members and our community members say weigh a lot. So it's important to understand that. And consequently, the advice given and concerns expressed regarding infant feeding may reflect cultural beliefs that do not promote or protect breastfeeding. So we need to understand when we're educating and working with families, as I know we have a variety of people here from various backgrounds and experience, to remember that Dr. Grandma, okay, Dr. Auntie, and the partners, all those people within that family need to be informed and educated in order to support that woman. We know when that happens, or the person breastfeeding rather, and when they're breastfeeding with that support, we know that they will breastfeed more, they will be more successful, and they will breastfeed longer. So it is a cultural and family and community support and education approach that needs to happen when we're working with communities, because cultural beliefs are important. Let's just talk about how it plays out with breastfeeding. That early introduction of complementary fluids and foods, that's a cultural belief. It's a cultural belief of not wanting to become too attached or spoil the infant, and holding the infant all the time is a way that the infant becomes spoiled. That's a cultural belief. And the thought that children need to be independent at very young ages because independence is viewed as a survival mechanism. Again, a cultural belief, because early independence is considered a positive attribute. Now, think about where those cultural beliefs came from. Think about their historical legacy, right? A child can't be too attached to their parent if they're enslaved, because they could be separated from their children at any point. We know that independence, right? Independence, children learning to be independent very early is important for them to survive if in case they're separated from their parents. And we also need to understand that the modes of parenting, right, reflect that historical legacy, right, that are perceived in some settings and by some people as harsh, but they're in that children were to be seen and not heard, because children, you wanted your children invisible, right? You wanted them to be as invisible as possible so that you could keep them as long as you could, so that they would not be sold off. So you were much harsher on the restrictions of their activity and behavior in order to make them as invisible as possible to avoid them being sold off from you. And those practices have continued culturally. Those are handed down through successive generations. But again, understanding where things come from. So why is this important? Again, because breastfeeding is the best preventative medicine that nature provides. So it's important, and let's put it this way, it's imperative that African Americans breastfeed. You know, we talk about health disparities in the data, and because it is so important in terms of a preventative medicine, it is one of those imperative tools that we must embrace. And that is why I believe that good health begins with breastfeeding. It is so important in our community. Nicole? The lack of breastfeeding, we know, is associated with increased infant morbidity due to a variety of infectious diseases and immune conditions, leading to increased infant mortality. We know that breastfeeding is the tool, as I spoke about, to eliminate health disparities. And I'm so glad to see the medical community and the public health community beginning to look at breastfeeding as a tool to eliminate health disparities. We know that it addresses social determinants of health, it impacts chronic diseases, it impacts infant mortality and maternal morbidity. And we also know it's important for mental wellness because of its role with postpartum depression. This is another one of our members breastfeeding a beautiful baby. And so that's why at the beginning of my presentation, I indicated that this also is not to be duplicated without permission because of these pictures that I have of Chocolate Milk Club members in them. But they're so beautiful that I wanted you to see the joy of women breastfeeding when they have been educated and supported and understand the importance of this practice. Now, understanding the relation to racial disparities in breastfeeding in the U.S. are the profound racial differences in circumstances and social determinants of health, which are products of systemic racism and its policies. So we're understanding how racism and health policies and the social determinants of health all interact to impact health as well as breastfeeding in this country. And I don't think we were having this discussion. As a matter of fact, I know we weren't having this discussion when I first started this work many years ago and looking at this as a tool. And so it's so exciting to see us moving in this direction to understand the importance of breastfeeding as a tool to address racial disparities. Okay. Now, we talk about social determinants of health. And one of the exciting things about breastfeeding is that it impacts all of these things, right? Social determinants of health are the non-medical factors that influence health, the places where people live. That includes housing, access to food. You know, we hear a lot of talk about food deserts, also where people learn, our schools and our educational systems work, the transportation, as well as associated stressors and the socioeconomic status and race. These all have a tremendous influence on maternal health outcomes, as well as breastfeeding. And so, as I said, it's just exciting to see people begin to understand the intersectionality of these things. Now, when we talk about health disparities, we know that Black women in the US are disproportionately affected by chronic disease and conditions that can impair not only pregnancy, but also breastfeeding outcomes. And these include hypertension, diabetes, obesity, also low birth weight and preterm birth. And we now understand that breastfeeding is a tool to eliminate some of this. And so we're going to talk a little bit about some of these as it relates to this. And remember, this is not an exhaustive list by any means, but these are just some of the highlights today. But it is really important to understand the importance of this form of infant feeding. It's the first and should be the preferred form of infant feeding because of these many benefits. It promotes uterine involution in the postpartum period, which reduces blood loss after delivery. It decreases postpartum hemorrhage, postpartum hemorrhage remains the #1 cause of maternal death worldwide. So breastfeeding is an important tool, and especially in places where there are a much lower access to resources than the US have. So it's really important, and it's also an important tool to out-of-hospital birth. Mothers who breastfeed for at least 3 months may lose more weight than those who don't. And so that's important when we talk about or think about the issues of obesity with American women that we're seeing. We know that exclusive breastfeeding for the first 6 months can help in child spacing. So lactation amenorrhea method, LAM, is a form of birth control. It provides some protection from pregnancy with exclusive breastfeeding for 6 months. That means exclusive, nothing else. And you have to not have your period during that time. As soon as your period returns, then there's that risk of pregnancy because of ovulation. But it's nature's way of spacing those babies out, and it does provide some protection. And it's important as well because it's going to also contribute to the reducing the risk of female cancers because of the lack of ovulation during that time, or a lack of decrease in the estrogen levels. And so breast cancer, uterine and ovarian cancer are also are going to be in decreased risk. When we look at infant health benefits, we know that African-American infants die at twice the rate of white infants before their first birthday. And according to the CDC, increased breastfeeding among Black women could decrease infant mortality rates by as much as 50%. And so that's a really significant number. We know that there's a large percentage of these infants that die from SIDS. And so we know that breastfeeding decreases risk of SIDS. So it's really an important tool to prevent SIDS. Nicole? Breastfed babies have less allergies, asthma, and eczema. And so eczema, allergies, and asthma are really prevalent in African-American community. And so anything that can help decrease these conditions in moms, new infants, excuse me, I think it's important. It also protects against type 1 diabetes. And diabetes is becoming a new public health epidemic in this country, with obesity and so forth, and an increasing number of children who are obese and developing type 1 diabetes. So again, this is a tool, and it also prevents childhood cancers. Breastfeeding also protects future cardiovascular health. So it's going to protect, it's a wonderful tool that pays forward, right? Because it decreases problems in infants during breastfeeding. It also protects their future health. So it's going to decrease the risk for obesity, diabetes, and hypertension, okay, by over 20%. And that's a big deal. And these are all chronic diseases that disproportionately affects African Americans. And actually, I believe the number is 23% specifically. So I think that's a big deal, because it's going to protect babies' health when they're in infancy and childhood, and then it's going to pay for to protect their future health in terms of cardiovascular. You can't get any drug that has that kind of effect. Now, we looked at additional health benefits, especially during now when we know that we have COVID-19. We know the antibodies are passed through breast milk. There's been a lot of misinformation during this pandemic, and when women were confused and felt like they should stop breastfeeding. And we know that we should not be stopping breastfeeding, because breastfeeding actually strengthens the infant's immune system. It provides protection from bacteria by exposure to mother's microbiome. And those antibodies are important to protect babies. So continue to encourage women to breastfeed. The CDC information is, as we always encourage women to use clean hands when they manage their breasts. If they have COVID, they're encouraging women to wear a mask when they feed their babies. But all in all, we pretty much know if mom's got it, baby probably does have it as well. But those are ways that you can reassure moms, because moms always want to do something, right, to protect their babies. The caregivers always want to keep their babies safe. So if they keep clean hands, use a mask, continue to breastfeed. Breastfeeding in itself is so healthy. The other thing that when we talk about social determinants, the economic benefits, right, is so important. Think about the cost of formula. We often talk about WIC and being a support, but it is not intended to provide formula for the whole month. It is an additional support for families. So breast formula, is very important. Infant formula, is very important. It's very costly. So it's really important that families know that they can save over $2,000 a year just by using their own breasts, which is what they were intended for. We know that breastfed babies have reduced healthcare costs because there's less sick infants. Therefore, that translates into less sick children and less pediatrician visits and less medical bills. So it's cost saving, and it reduces moms' times taken off work for 6 children. So it really has an economic benefit for families as well as for the healthcare system in general. And breastfeeding also is a social justice issue, because we talk about racism and understanding this is a system. It's a social justice issues, right? And so when women trust the makers of baby formula, Nicole, thank you, more than we do our own ability to nourish our babies. Nicole, can you move the slide for me, please? Ability to nourish our babies, we lose a chance to claim, you're moving a little ahead, I'm sorry, go back, please. Thank you. Technology is great, but there's always those little hiccups. So
There's a little
thank you.
delay to Dr. Moore. So there's a delay. I move it, but it doesn't show you for like another few seconds. Sorry about that.
Okay, no worries, no worries. It's always, you know, technology is beautiful when it works, right? Okay. Oops. So when women trust the makers of baby formula more than we do our own ability to nourish our babies, we lose a chance to claim an aspect of our power as women. And thinking that baby formula is as good as breast milk is like believing that that 30 years of technology is superior to 3 million years of nature, right? Countless women have regained trust in their bodies through nursing their children, even if they weren't sure at first that they could. And it's an act of female power. And Dr. Christine Northrup, who is a well-known medical specialist that is an activist around women's health, talks about it being feminism in its purest form. Okay. So breastfeeding can be considered as a revolutionary act. And because it goes against the racist and capitalist deconditioning, excuse me, the capitalist conditioning, declaring our breasts not as sexual items, but as instruments of nourishment for our children. So it is a social justice issue, it's an empowerment issue, it's a womanist issue. And so I think, you know, when we talk about all these factors and their intersectionality, it's important because it's impactful. Breastfeeding hits all of these areas. We also know that it's important for mental wellness. The depression rate among Black women is estimated to be almost at 50% higher than white women. And to know that breastfeeding mitigates postpartum depression and birth trauma is so important. We know that women who have depression are at greater risk for having postpartum depression. So having breastfeeding as a tool is important to help these women. Go ahead, Nicole. And let's look at the neuroscience. And this is the area that really got me excited when I first started this work, because breastfeeding is not just about nourishment, but it's also about nurturing, comfort, right? And bonding, which reflects safety for an infant. So breastfeeding impacts parenting by increasing responsiveness. So we talk about it creates responsive parenting versus reactive parenting. And so how we approach our children even changes from breastfeeding. Go ahead. So this slide is Dr. Niels Bergman's work, and it's an exciting piece about the neuroscience of breastfeeding, because we know amongst this that it includes the DNA or the epigenetics, and we have the brain, the neural development, and then our biology, and all of this connects to the environment and the adaptation experience for infants, from the intrauterine environment to the extrauterine environment. And we know that immediate parent-infant skin to skin, which is what breastfeeding is, right? Which is holding our babies directly after birth, which is what midwives have done forever, is to give the baby to the mom. How important this is, because mom is the environment for the baby, okay? That's the safest place for the baby. And as you move to the next slide, we find that this is important because it eliminates the stress that is present just from the infant, from the process of birth, of the infant adapting to the external environment, which is their new environment externally. So it's moving from the internal uterine to the external environment. And that breastfeeding alone helps to decrease toxic stress that can occur in itself from childbirth, and especially with separation being moved away from your mother after delivery can create toxic stress that can lead to insensitive parenting, disordered attachment, and vulnerability that can lead to actual disease. Whereas skin to skin is going to promote bonding and sensitization. It's going to actually improve outcomes or success for breastfeeding. It's going to create secure attachment, which helps a mother, that bonding and that breastfeeding helps a mother to be more attuned or responsive to her child, which is going to create a resilient, healthy infant. So the neuroscience of that is also important. And the other piece of that is because breastfeeding also has the ability to reroute damaged pathways and heal areas that have been damaged in utero, particularly if a mother has used drugs or some other issues that may have damaged those neural pathways. And that's the piece that really got me excited of the healing of the pathways, creating that secure attachment for infants, and how important that was. Because when I started looking at this work and breastfeeding as a tool in the African American community, it was during the epidemic time of crack cocaine epidemic, and thinking of solutions on how we could heal the brain and what we could do to address some of these things that have happened, those damaged pathways from drug use. And so when I saw this research and heard Dr. Niels Bergman speak, I was just excited again about the potential for breastfeeding for healing trauma, okay, in our bodies, healing literal trauma that has occurred in our bodies. And this is another example of an excellent tool. So when we just talk about some of those basics of how all these things connect, I think this just gets to the essence that breastfeeding creates secure attachment, which leads to resilience and good health in babies, okay? And that's what we want. We want parents who are sensitized to their children, they're in tune with their children, they're connected with their babies, they're feeding their babies, and that creates good health. And the research has shown that without that, you have toxic stress, you have children that are disordered and unattached, you have parents that are insensitive, you have that creates a whole vulnerability that creates disease. And so again, good health and good parenting starts at breastfeeding. Next, Nicole. So taking all that in, I want to share a case study that looks at a 37-year-old obese African-American woman. She's been pregnant 3 times, G3. She's a P2103. That means she's had 2 full-term births, 1 preterm. All 3 were born live and by normal spontaneous vaginal delivery. Her preterm birth was at 36 and 3. She had no other significant past medical history. And that's kind of her OBGYN in history point. This current pregnancy, she had a vaginal delivery of an infant male at 39 plus 5 weeks. She was delivered in the hospital with an MD on April 2nd. She had an infant male that weighed approximately 5 pounds and 13 ounces. She had no history of GDM, gestational diabetes, pregnancy-induced hypertension, or preterm labor symptoms during her pregnancy. She labored for about 7 hours. Okay, that's her first stage. She pushed for about an hour, second, and 30 minutes for her third stage, or placenta, to come out. She had an epidural for pain management, and she reports that she immediately had difficulty with latch after birth because, and she also explained that her infant was weighed and other procedures done prior to the infant being given to her to feed. So those of you who are here know that that golden hour, that first hour after birth, is really important for successful breastfeeding. And so we encourage infants not being separated from moms right after delivery. Then, of course, infant began to have some low blood sugars and was given a bottle with formula twice. And then the mother explained that ever since then, the infant had difficulty latching. She reports breastfeeding her other children for 2 to 3 months. So she understood the basics, mechanics and importance of breastfeeding, and she wanted to breastfeed her babies longer this time. She did not see a lactation consultant before she left the hospital. And this person was someone that I was asked to see on an outpatient basis by her pediatrician. And I apologize for the jumbling of this case study. Is a lot of detail, but we weren't able to pull up the newer slides. So in event, I saw this woman in the early evening, 10 days postpartum, and I did a home visit for her. She had been seen the same day by the pediatrician for her first newborn check. So that infant, which was seen that first 7 to 10 days, which is what we recommend after delivery. The infant weight was 5 pounds, 13 ounces. She had been discharged from the hospital without a breast pump, and she was using a silicone-like pump device, which is like a haka for milk removal and collection from her breast. And she had been wearing the device bilaterally all day. So she had been wearing a haka on both sides all day long when I saw her. So you can move the slide, Michelle, for me. So when I saw her, this is an example of what her breast looked like when I saw her. Can you move it up one more time, Michelle? I want to show the device itself. Nope, you moved it up too fast. Sorry, there's a picture of the device. Go back, please. Go back. There you go. So that's a haka. That's a silicone device that's used on the breast as a milk collector. You can go back, Michelle, to the case study. I keep calling you Michelle, I'm sorry. Nicole, to the case study, thank you. And so she was wearing both of those, she was wearing on her breast. You can leave it there in the picture, that's fine. You can leave it on the picture, my dear. You can, both of her breasts, she was wearing this haka device, and she had been wearing it all day because she had been discharged without a breast pump. You can see the delineated line around her breast tissue where the haka had been. You see the breast edema from the breast as well. And we know, first of all, if we back up and talk a little bit about her delivery, one of the key factors that put her at risk for breast edema in itself was that she had an epidural. And we know that an epidural can cause some breast edema naturally. And then to wear this haka device, she had been wearing that since discharge to collect breast milk because she really was committed to breastfeeding. She had this edema when I saw her. And so I know it's a little difficult to talk about what potentially is the best option for her, but one was to get a breast pump ordered. One was to apply some coat packs to her breast bilaterally to address her edema. One was to use nipple shields on her breast to try to extend the nipple out well enough for the infant to latch. She was able to apply her infant to her breast without pain with those pieces, and she did get a breast pump that we ordered through our normal company, and there was a delay in getting that to her, which was a little bit problematic as well. She did not stay breastfeeding as long as she would have. You can go back to the case study, Nicole, thank you. She did not breastfeed as long as I would have liked her to because of her just difficulty with latch. As you can see on the case study, she did have a small infant. We know that infants that are born small may not have the ability to suck for a prolonged time. They may not have the suction, the fat pads, or the energy. And so sometimes those infants just have to build more weight, and practice makes perfect, as I explained with moms, and they need to latch every feeding, even if you have to supplement them, just to practice, but you don't want to let them fuss at the breast long because we don't want a negative association with breastfeeding. We want to use that shield to give them something to grab that's easier for a small infant to grab, and that nipple shield can do that. And we want to pump after every feeding, and really pump regularly, period, every couple hours actually, to maintain that infant, that milk supply for that infant. So the other thing is the healthcare provider failed to make sure that she was seen by a lactation consultant in the hospital. And we didn't, and there was no connection to community resources for her when she went home. And that's one of the things that our system has not been as good at, is connecting them. What's in the community for these women? So for African-American women who are breastfeeding and need support, there are resources for them in the community. You know, there's different programs that they're involved in often when they're pregnant, but we do know the Chocolate Milk Club is a resource for these women in the community, because that's one of the pieces that I found was missing. Is that connection with a community resource to continue to help give them the support that they need. The haka is best used on the breast during feeding on this opposite side. So whatever, of course, whatever side you're feeding on, you would wear the haka on the opposite side, because letdown can occur when you're nursing. And so because this milk is so valuable and precious, you can wear a haka type of a device, a silicone breast pump, to remove that milk from the other breast for storage. But you don't want to be using those all day long to collect milk. And again, we failed this woman because that was our fault. We sent her home with no breast pump. And so therefore that's what she did, because she wanted to preserve her milk as much as possible. She was successful for breastfeeding for approximately about 3 months, and then gave up. It was just had been so much for her that she decided not to continue. But because breast milk is dose dependent and every little bit counts, even 3 months of breastfeeding after coming home with no breast pump, having swollen edematous areola like that, difficulty latching, all the things that she overcame to continue to breastfeed was still so important. And to me, she was still very successful. So even though she only was able to continue for 2 to 3 months, we prevented a breakdown in the tissue. So she didn't have any tissue breakdown from this process. We were able to get the swelling down, and we were able to get baby to latch onto her breast eventually. So I just wanted to share the importance of making sure people have the resources, that they see the lactation consultant before they leave the hospital, that we're talking to women about breastfeeding during prenatal care. We have a long period of time during prenatal care to talk with women about breastfeeding. So we need to do that and educate them and make sure they have the materials and support that they need prior to delivery. And again, encourage every woman who's going to breastfeed in a facility. And a lot of our facilities, North Memorial, Hennepin, a lot of the places people are delivering, do have lactation consultants in-house. Make sure these women see them before they leave, and that they're connected for follow-up visits in the community with either a lactation consultant or other support peer program upon discharge. Because the more support that they have, the more successful they will be, and the longer they will breastfeed. So I know we are run out of time. Are there any questions?
Thank you, Dr. Moore, for your wonderful presentation. I have heard you before, but every time I sit through your talks, I learn something new and valuable tools to pass on to community members. Zora will help with the Q&A. If you have questions, please put them in the chat.
Yes, it looks like we probably have time for about 1 or 2 questions. I know we are kind of at time here, so if you have any questions, again, like Nicole said, just put them in the chat or the Q&A. It looks like I
did include my, Okay, I did include my contact information as well as there. And just so people are aware, that information is there as well. So if you have questions about Chocolate Milk Club as well, you can get back to me regarding that.
Yep, and that was one of the questions, just how can women get involved in Chocolate Milk Moms?
Right. If you have a breastfeeding mother who is actually breastfeeding, she can, Chocolate Milk Club, we can be joined Chocolate Milk Club through Facebook. Chocolate Milk Club is a private club on Facebook. That is where all of the information and our current events happen through that space. We are a non-traditional breastfeeding support process. I don't have enough time to share with all the details about that, but just know that we have current women who are breastfeeding. We have our breastfeeding ambassadors who continue to stay involved with us as they are our goodwill ambassadors, supporting breastfeeding and promoting it within the community. We have peer educators and other events that happen monthly, continuously, basically. So that is the area where they ask to join. That is where all the information is shared. And we have our New Year New Year gathering will be January 2nd. For those members that are involved, we have a chocolate milk day every year in August during World Breastfeeding Week. We also have a breastfeeding award, the Rhonda White's breastfeeding award that we give out to community activists for women who are promoting and supporting breastfeeding in the community. So we have a lot of activities going on through Chocolate Milk Club.
Thank you, Dr. Moore. I'm not seeing any more
Thank you.
questions, so I think I'll pass it to Nicole and we'll wrap things up.
Okay. Well, thank you, everyone. We do know we went over
Thank
time.
you.
I did present, paste Dr. Moore's information in the chat for everyone to copy and paste that information. It was on the screen just for a few seconds. We'd like to thank our sponsors, the Department of DHS, for bringing this valuable presentation to us. Again, thank you, Dr. Moore, for being a resource to women in the community and for being willing to connect people to so many amazing resources with the Chocolate Milk Mom Club. Thank you, everyone, for attending. And Zora will paste the next series in the chat as well. Our next series will be with Samira Bilal Roby, and it will be around ACEs and trauma. And that will happen on December 28th. Thank you, everyone. And please share this information with your colleagues. Have a great day.
Thank you. Thank you. Thank you for having me. Bye-bye.